Another story that stuck with me. It was when I was training in the pediatric ICU because I wanted to be a nurse anesthetist at one point in my career, and I needed some other experience besides babies. So I was in the pediatric ICU, I was coming into work, and the charge nurse for my NICU said, you're going to put in a PICC line. And a PICC line is different than a standard IV. A standard IV only travels about an inch underneath the skin into the vein, and this IV travels from wherever you insert it, whether it's the feet, the hands, or the limbs, and it will go all the way into the major vein of the heart. And I was trained in doing those. And she said, you're going to put one in this baby tonight. This baby needs this PICC line. If he doesn't get this PICC line tonight, he will not go to cardiac cath tomorrow. And cardiac cath is like a cardiac surgery. And so that felt like a big responsibility. Immediately I was intimidated. I didn't want to do it. I am not the person who wants to show off and prove people wrong. If anything, I little myself because I get kind of scared under pressure. And I told her, no, you do it. You stay later. When you're done with your job, just come put it in. And she goes, no, I'm not staying. I told them, you're doing it and you're going to do it. And your coworker, Lachelle, is going to help you hold. You're not going to be in training tonight. This is your assignment tonight. So I was super intimidated, but I knew I had to do it. And I'm looking for veins to try to get this PICC line on this baby, and there wasn't a lot left. This baby was a few months old and didn't have a lot of things to work with. And I found a vein kind of around the armpit area. Had never gone there before, had never gone there since then. But I found that that was the only viable vein I could see and inserted it. At that point, you don't know if the catheter tunnels up or tunnels towards the heart. So you have to take an x-ray. So I remember I was in the x-ray room. We had taken a film when I was done with my procedure, and we were waiting for it to load up on the computer with my coworker and the doctor. And when it loaded up, I immediately saw that tip pointing downwards into that vessel of the heart. And I was like, yes! And I was jumping up and down because I had gotten it. And it was the only nurse in the hospital that night who could perform that procedure for that baby. And his surgery relied on me getting that line. And I remember in the morning, the doctors came around and they were doing their rounds, and they had just assumed this baby had no access, that this line wasn't placed, nobody got it, and this baby wasn't going to surgery. But somebody paused and said, no, actually he got a line last night. And the cardiac surgeon was like stunned, like, huh? Who? And they were telling him, I don't know, this girl that works in the NICU, I guess she puts him in. And he was like, go get her. And so they got me and had me stand, and he's like, who are you? Where'd you come from? Like, how do you know how to do these? Who taught you how to do this? And it was the first time that I was formally introduced to that cardiac team, and they were just so thankful. And I felt like I was so destined for that night. I was destined to go into work that night, be on assignment that night, be in the position to even be recognized to put that PICC line in that night. And I felt like I was really, really a NICU nurse at